According to the latest government figures, the UK has recorded the highest number of confirmed COVID-19 deaths in Europe, now second in the world to the US, with more than 31,000 deaths and 215,000 confirmed cases. So what is it like to be on the front line? Well, I had the honour to interview Mark Young, who is a healthcare worker in the UK, and I spoke with him yesterday. Mark, thank you so much for joining me on Weekend Edition. This week, Foreign Secretary Dominic Raab said it was a massive tragedy at the announcement of the UK having the highest deaths in Europe. As a healthcare worker, can you give us an understanding of exactly what it's like in terms of the scale of this pandemic?
There's absolutely no way to describe the accuracy of this pandemic and the effect that it's had on the NHS. We're not used to seeing the numbers of patients or indeed the calibre of these patients on this scale, and I don't think any hospital anywhere in the world ever has, and hopefully we'll never see it again. The numbers that we're looking at have risen astronomically, and I believe the death toll at the moment we're looking at is over 30,000. So, and that's deaths. So this country is used to seeing, a lot fewer than that. And the worst point over the last 5 years, if you look at the statistics, I think the worst that we've ever seen in 1 year was 28,000, but that was spread over a 6-month period. We've seen 30,000 patients in 6 or 7 weeks, and that has absolutely put the NHS on the back foot, but we've coped incredibly well with it so far.
This is a new virus. We've heard conflicting stories of it being perhaps targeted to the elderly, the more vulnerable. In your opinion, Mark, what have you experienced?
This virus has absolutely no bounds at all. It doesn't discriminate. It will attack the young as well as the old. The majority of the patients that we're seeing on intensive care are certainly in and around the sort of early 40s to late 50s. We're seeing people who are chronic. They have underlying illness, of course, but we're also seeing patients who are fit as a fiddle, patients who ordinarily would just shake off a flu virus. So once patients have contracted this and end up in intensive care, in effect, it's very much a lottery as to whether or not they're going to survive, and it's very difficult for any of our consultants to predict who's going to make it through and who's not. The virus has hit hundreds of thousands of people. The wards are coping as best they can do. It's a very small number of these hundreds of thousands that are making it into the intensive care units. But we know that the death tolls are astronomical. I mean, at the moment, we're averaging in the UK probably around about 612 deaths per day. That is unprecedented anywhere in the world.
And how different are each symptoms of each patient?
The key symptoms that we're looking at for a lot of these patients is severe respiratory difficulty. They have an acute inability to breathe properly. We can ventilate them, but we just can't oxygenate them. We cannot get enough oxygen into the bloodstream in order for patients to stay alive, and as a result, they're starting to succumb to multiple organ failure. And again, that's something that we don't typically see when patients come into intensive care. We are very good in medicine at chasing the science and following the numbers and being directed by that. And this virus just hasn't behaved the way that it should do. We were told to expect something along the lines of an atypical pneumonia, something that happens all over the world every year and affects all sorts of people all over the world every year, and most people just fight it off. It is really sort of quite bizarre that the patients will present initially with acute shortness of breath. Some of them will get better, some of them will get worse. We will get patients with they've loss of smell, loss of taste, patients with gastrointestinal problems, and they get acute diarrhea. And then everything else that you can throw in on top of that, you can throw in. No two patients are the same. They'll all share the difficulty in breathing side of it, but the other side of the symptoms that they're going to present with, you just can't predict. You seriously cannot predict who they are or what they're going to do next. You have no prediction over how all the usual support drugs and mechanisms that we would use are going to work or not work. And I think that's surprised an awful lot of consultants who have been in medicine and intensive care and anaesthetics for some 20 and 30 years, and it's really caught them on the hop. And the number of meetings that we sit and listen through on daily briefings. And again, it's a lottery. Shall we try this drug? Shall we try that drug? But the one thing that we do know that works is regularly turning the patients to face down to face up in order to try and shunt the blood in the right direction so that it's encouraged to accept oxygen molecules. But again, as I say, it's very, very difficult. This is not behaving like a normal pneumonia. Antibiotics are not working for anything with these patients. And to provide acute intensive care nursing for these patients, trying to suck out the thick secretion from these patients is incredibly difficult. If you can imagine trying to suck out peanut butter using a plastic straw from a jar, that's pretty much what it's like. You can't get hold of it, you can't loosen it up, and you just can't suck it into the catheters to get it out. So these patients are actually suffocating, and it's not a very dignified way to go.
Mark, we hear that you often are very low on equipment for patients, for yourselves, including PPE. Are you also low on staff numbers?
We're incredibly low on staff numbers. We've got a lot of staff who've had to self-isolate. Equally, we've got staff who've got sick, frail, or disabled family at home. I know of one paramedic and nurse team, their daughter has leukemia, so one of them has elected to stay at home and look after the daughter whilst the other one has booked himself into a hotel in order to keep going to work and bringing the money home, I guess. But I know he hasn't seen his daughter in nearly 8 weeks. That's 8 weeks of isolation, and the only thing he can do is use a tablet of an evening to talk to his daughter before she goes to bed and bath time. In terms of PPE, we're running out. We don't even have enough scrubs for people. We've got hospitals who are using clinical waste bags with holes in to act as gowns to wear over the top of their uniforms. We're running out of gloves. We're running out of visors. The government has spent a huge amount of money and effort to buy PPE in from parts of Europe, and that PPE has arrived, and unfortunately it's not been fit for purpose. It's not good enough for us to work in the environments that we're working in. But even the masks that we do use, the FFP3 masks, they're very low on supply. They're very difficult to get hold of in the UK. The prices being asked for are going up and up and up, and staff are being asked to try and purchase their own masks. And people are using all manner of things to create visors just to try and protect themselves. And it's stuff that should be available for us, and it's just not there.
Mark, we've had a huge number of COVID patients coming into the hospitals, including the hospital that you work in. Can you tell us about how the staff have been doing?
From a nursing point of view, they've been doing really well. They've been worked to the bone, long hours, long days, and no rests. We've been unfortunate in that we've had several of our own colleagues come through as intensive care patients. One nurse survived, and we didn't think that she would, and another nurse sadly passed away only days after giving birth to her daughter, who she's never seen. But the telling in all of this is when your consultants come into work of a morning and they sit and they look at each other and they're signing each other's wills, that's the bit that needs to sort of ring through to people. Consultants with 20, 30, 40 years experience are taking this seriously. They don't know if they're going to be going home tonight or whether they're going to be admitted with a cough that might kill them.
If there was one main message that you want to leave people listening with, what would that be, Mark?
There's a reason why we're asking you to stay at home. This is an unforgiving virus that will attack anybody that it comes in contact with. You might survive, in which case you're going to have the worst flu symptoms you've ever had in your entire life. But if you give that to somebody who is compromised with their health, if they've got diabetes, heart disease, renal problems, you could very well sign the death warrant and you could end up putting these people in intensive care. Please stay at home. All we're asking you to do is sit on the sofa, watch TV, have a beer, play with your children, and don't go out and mix socially. Let this virus wipe itself out.
Mark Young, you are an absolute inspiration, and we really appreciate your time on Weekend Edition. Thank you so much, and stay well.
Thank you very much, and the same to you guys. Take care.